Hopefully it's not a bad stormy day going out here. Not too much wind. All right, just dropped my video here on the disc and lumbar spine. A 5-7 minute video. Trying to make them no longer than that. Hopefully that'll help you guys draw all out. If you have any questions on that, you can always DM me. Hello! So everybody's out walking like me. See that? Maybe they've listened to my channel. So yeah, we talked about the big three: the bulge, the herniation, the rupture. And technically, there's really four real disc definitions. Hi! There's the bulge everybody knows about, or the whole idea of the donut squeezing out and coming back in. And then there's the sequester, which really means that it comes out and it kind of flows out through that disc, which it's not supposed to do. It's supposed to stay inside. And then there's the actual rupture of the herniation, and then an actual rupture where I talked about where the disc really just kind of tears off and floats inside there. Hi! And so, when you're dealing with a disc issue, and really what I didn't speak about on this video was that first 72 hours, you really want to make sure that you're icing it, that you're eliminating all that static sitting, because that's just going to aggravate that disc is going to keep pushing out. Because if you look at really the structure of the disc, the outer part of your disc in your spine is very fibrous. It's very thick and very dense. And so, it's designed to take the beating. It's the inner part that's think of a healthy disc as wet seaweed. The texture of it is kind of like that. And then when you get degeneration, or you get that disc that starts to break down, it becomes like a dried out seaweed. So that's what you want to be mindful of, that, because the outer wall of the disc, has no nerve endings to it. So you can have tears within that disc for decades, as long as you're not getting the outer part of that disc pushed out towards that nerve. Then you're not gonna feel it. You're never gonna have any symptoms, because it's not until you kick in that inflammatory process where you really start to have the symptoms, and you start to feel, pain in the back, pain in the butt cheek, pain in the groin, pain in the nether legions. You can referral pain and radicular pain. See, two different things. And I'll probably bring up a video on that at some point. Referral pain and radicular pain are not one and the same. Two different things. Referral pain is actually could come from an organ, like your kidneys. If you have a kidney stone, that can go ahead and give you referral pain up your back. Now, radicular symptoms are like a nerve, where it gets something impacts it, whether structurally, like we talked about today, a disc issue, or it could be a virus attacks it. It could be a bacterial infection that attacks that nerve, and it causes that nerve to flare up or cascade and start giving you signals saying, hey, there's something wrong. And so when you're looking at the radicular symptoms, it's always in a pattern. Referral pain can be in a pattern, but not always. But radicular pain, like what we're talking about today, like the back, the sciatica, is always in a pattern. And what I mean by that is, if you have like numbness, burning, or tingly in like the back of your calf, that's your S1 nerve. If you have pain along the inside of your shin, that's L5 nerve. If you have pain at your big toe, that can be L5 and S1. So, and you have pain at your thigh and so on and so forth, that can be L2, L3 nerve. So that's how, as a clinician, we figure out where your symptoms are coming from, what nerve root. And then we'll do some reflex testing with a little reflex hammer. We might do some sensation testing when we have you close your eyes and see if you have a loss of sensation. And then we'll go ahead and easily, get an X-ray done because those are the cheapest, just to make sure you're not missing anything. Maybe it's something that's not like a disc. Maybe it's something else like multiple sclerosis that's causing your symptoms, because it's or an MRI to really pick out whether it's MS or it's some sort of neurological issue, or if it really is just, yeah, you blow out you have a bolt, or you had a herniation or whatever in your disc. So hey, brown-eyed truckers out there. Ooh, that's a big anthill. Look at ooh, look at how big that anthill is. That is a big anthill. Ooh, don't want to step on that. There's fire ants, deadly. All right, so we're talking about that radicular symptom. So that's the difference between the two. Now, referral pain, like I said, could be coming from an organ. It could be coming from a muscle. In the muscle pain, you feel like it's in your thigh. Oh yeah, yeah. I'm hoping. Well, I mean, the video I did today, as well as all the other little links I put in, that really does give you a really good idea. I mean, a sound clinical judgment idea what's really going on. Whether it's truly coming from your back. Most times than not, it is. To kind of branch out for what my video was today. They'll always try and diagnose with like a hip bursitis or sacroiliac, which is your SI joint. They'll try and do that. And the reality is more times than not, it's coming from your back, whether it's a nerve that's referred, or like my last video, the facet joint arthritis is kicking in and giving you a lot of pain. So it's usually one of two things. It's either the disc is worn down so much that the facet joint's getting irritated, like what happens with me, or it's because the inflammatory process is so bad. The inflammatory process is so bad that it's referring pain. Until you get that inflammatory process to calm down, which is what your medical doctor's trying to do. They're trying to give you steroids, muscle relaxers. They might give you a 5 or 6 day supply of oxycodone. For a nerve, they might give you some Neurontin or gabapentin to calm down that nerve pain. So that's really, they're just trying to get you through the inflammatory phase, because as long as you don't re-aggravate it, scar tissue is going to come down and heal across that disc. If it's a disc issue, if a bulge came out and pushed on that nerve and then retracted back into the normal disc space, but you had that inflammatory process that occurred, normally the drugs will calm that down. But you have to stay away from what caused it in the first place, and allowing the scar tissue to scar down that disc so it can take the beating again. And then, like I said at the end of my video, is once you've gone through that period, you have to gone through that recovery period phase, and then you have to go into the let's not have this happen again phase. That's what I talk about: strengthening of abdominal, strengthening of the lower lumbar spine. I did a video about 1.5 years, 2 years ago on the geez, let me think of what it was. It was it just popped out of my head. The multifidus. I did a whole thing on the multifidus muscle in your lumbar spine, and how important it is to the disc when you have a disc issue in your spine. And if you don't start to strengthen again, that multifidus muscle, which really helps stabilize your lower part of your spine, that L5S1, it starts to shrink. And then there's tons of research, clinical research, that shows if you just keep, you go into this recovery phase, you get better, you beat it up again, you recover again, you beat it up again, that multifidus muscle can actually get fat deposits in it. So you're dealing with a muscle that's got fatty cellular tissue in it, and then you're in real trouble. And you wonder, these are the patients that have recurrent back problems, recurrent surgeries, because those muscle groups are actually, and an MRI, it's clinical research. This is proven. This isn't just me spouting. The muscles themselves literally get fat in them, and so that's you want to get away from that. So you got to strengthen that multifidus. Everybody's always worried about their abdominals. Yeah, you have to have core abdominals, but that's not the real issue. You have large muscles in the front of you. If you look at your lower back, they are tiny muscles. They have to do a lot of work. And so when they do get injured, and since they're smaller, it's harder for them to recover. So you have to be mindful of that. I give the same example as your bicep versus your tricep. Now, hence bicep is 2, tricep is 3. It's just a basic Latin word. But if you injure your bicep, it's 2 muscles. If you injure your triceps, your recovery should be a little bit shorter because you have 3 muscle groups versus 2 muscle groups in the front. So, I'll go into this maybe in a rotator cuff shoulder. Maybe I'll do it as a podcast. I don't know. I mean, I'll just do it as a video to where why you want to strengthen your rotator cuff a certain way because the way the number of muscles are on one side of the shoulder versus muscles on the other side and how they're designed. This and the not only the size of them but the length of them, how long they are. So and how they're placed in the shoulder. So and in this session, really, we're talking about the back and how it's very important that you don't over focus on your stomach muscles and completely neglect your lower back muscles because people don't think about that. So you have to make sure that, like I talk about, you have to have a rigid spine or stable spine, and you'll notice that you won't have the injuries anymore, and you'll be able to take more of an impact because, like I said in one of my previous walks, once you've injured something, you're only going to recover the tensile strength of that is about 80%. So what I mean by that is when your disc heals up and it scars down, it's only about the 80% as strong as it was before. And that's as good as it's going to get. And that's why you need to have compensation from your back muscles and your stomach muscles to make up the other 20%. Because you can't go back to how you used to be. You have to compensate for all that disc issue. And if you don't, then that's why you keep re-injuring it over and over and over again. And then, like I said, the multifidus gets fatty, and then you just throw your hands up in the air, and 3 surgeries later, you're not any better than you were before. And then you're on disability the rest of your life, and you're depressed all the time. So that's, a podcast would be nice. Yeah. I mean, everybody's got a podcast, right? So that's why I'm trying to do a little bit of video in combination with the short clips and the combination of the actual long content, which is 5 to 7 minutes. I try not to do any content any longer than that. But so we talked about radicular pain, referral pain, the 2 differences, because there's a big difference between the 2. And we talked about the disc, the 4 different types of injuries. And we talked about how to recover, or after you've recovered, the walking like I'm doing right now. The next thing you have to worry about is what happens if it doesn't calm down? Okay, what happens if you're 6 weeks in and you're still having a lot of nerve pain? You're like, uh-oh. So 2 things to worry about there. 1, are you having any ankle or leg weakness like your leg wants to buckle? Okay, because if you're having those symptoms, well, let me step it back. The reason why you're having those symptoms is because the nerve gives a signal to the muscle for 2 things: sensation and motor or movement. It actually, the power of the muscle to do what it's supposed to is signaled by the nerve. But the sensation, hot, cold, numbness, tingly, burning, that's what I'm referring to with sensation. So if you're having where your leg is weak, the leg's giving out, now you've gone from sensation issues. That nerve is so irritated, it's now affecting your motor. And so that is a problem. You are in trouble. It's red alert time. So what you have to do there is you literally have to, that's something in my stock, sorry about that. You literally have to dial it back. You got to go all the way back to the first phase of trying to heal: ice, inflammation, reducing those by medications. You're going to go back to staying away from prolonged sitting as much as you possibly can. Get up and walk around. Don't be a letter C. Stay out of that letter C of your spine that I talk about all the time. That should calm the nerves down again. And that should give you about a week of reprieve. Imagine 3-4 days of just probably relentless symptoms getting worse and getting better, getting worse and getting better, and starting to taper off. If your nerve symptoms are starting to taper off, the first thing you should see improve is that your leg isn't buckling. It feels a little bit stronger underneath you. Now your sensation is still going to be numbness and burning, okay? Because what comes back is your motor strength comes back, and then your sensation comes back, and then everything starts to feel better from there. And it's the same thing forwards. When you injure yourself, the first thing that goes is sensation. Your body's telling you something, and then all of a sudden you start to get weaker, and that's your body saying, okay, something's really wrong. So, and that's what happens when you recover. It literally goes in reverse. So that's huge. So once you've gotten through that first 72, 120 hours, 3-4 days, once you've gotten through that phase of your disc issue and you notice your leg symptoms ain't as bad, or maybe it's just in your hip, or maybe it's just in your groin and your crotch area, the symptoms, then you can go ahead and start doing what I've told you before in the past, is trying to lay on your stomach with a pill like I showed in the video today, and do that at least 3 to 4 times a day, and be in that position for about 15 minutes with ice in your lower back. I've talked about that since the cows come home. And what you want to do, the reason why you're doing that is it's literally pulling that joint, that spine, back into straightened position like I showed in the video today. Because you didn't injure your disc by being in that nice straight position. You injured your spine and your disc and your muscles by being in that flex position. So we get you out of that position for as much as we possibly can so that you can help. You want to get your spine in the best possible position it can to recover, right? Like anything in life. If you want something to recover fast, you got to hit it with a lot of healthy things. You got to be drinking enough water, you got to be eating the right foods, which is a lot of protein. So when you injure yourself, protein, and vegetables. Stay away from the sugars. It's too easy to eat sugar all the time. So you want to start that. You want to sleep. Hopefully at that point, be able to sleep a little bit more. Stay away from the recliner chairs. Stay away from soft stools, rocker chairs, because they're all going to make you go into a flex position. That C. You want to stay out of that C. Like I said, and then we go into what I call the McKenzie program. It's an old program. Robin McKenzie came up with it forever ago. And that's where you're on your stomach with a pillow and you come up on your elbows. I got a McKenzie video in my lower spine videos. I linked today all my lumbar spine videos, so you can go in there, look for McKenzie, and you'll see it. Goes through the entire program of on your stomach with pillows, then without pillows, up on your elbows, okay, and then doing a partial press up, and then going into a full press up on your stomach. And you do that over a series of weeks. And that way, the whole idea is get your spine going in the opposite direction, going from a flex position, going into an extended position. Now, you only want to do that, and I talk about that in the video, in where you're not having any shooting pain down your legs. If you're having shooting pain down your legs, you don't want to progress that. But anyways, that's a whole Robin McKenzie program that I talked about, and you can go ahead and look on the videos for that one. That'll help. That helps a lot. And once you get to that, then you can go ahead and go into my back strengthening program, where you're on your stomach with a pillow and doing one arm, one leg kickback, alternates and stuff like that to really start to strengthen your multifidus muscle. While you were eating ice cream, yes, that's if you're having back problems, the last thing you need to be doing is eating simple sugars, okay, which is, all the white sugar, the ice creams, the candies, even the complex carbohydrates, the pastas, the breads, Those are still, their body still processes it as sugar. You got to get into, what's it, 80? When you injure yourself, they say, I think it's 80 to 100 grams of protein a day you're supposed to take in, because your muscles, your muscles that are injured and the scar tissue that's trying to help lay it down are all made with protein. So where's your body going to get that protein if you don't eat any of it? So if you want to heal yourself faster, it's kind of like a car, kind of like the truck. Okay, if you go ahead and put water in your truck versus putting diesel fuel, good luck running that vehicle very long. Same idea with the human body. Yeah. We know if you want to build, you have to have complex protein chains without going into crazy detail on it, so that your body can rebuild and repair that stuff. So that's what you have to do. I mean, that's in that water. I mean, we're like 80% bags of water, anyways. So if you're dehydrated, it's very hard to get that protein where it's supposed to. So it's one of those things. You got to feel the system. If you want to heal, you want to recover, you got to do the right things. You can't do the opposite things expecting to recover. You will recover. You recover very, very slowly, and you won't cover the same as you would. You won't be as strong as you would have been. Excuse me. So once you've gone through the McKenzie program, and you've gone through what we call prone extension-based program with your arms and legs, and then work into the clamshells and stuff like that I showed in my past videos with TheraBand, with rubber bands, you definitely will see the big difference. So, I mean, it's huge. If you do those few things, you really will see your back symptoms not only recover, you'll rebound much faster, and will take a lot more to injure you that next time. You'll just be able to tolerate things a lot more without having symptoms. So, and hey, I'm all about having less leg symptoms and back symptoms. It's no fun at all. I don't see anybody signing up for sciatica pain. If they are, they need to have their head examined. So, let's talk about a story. Horror story of therapy. I always like to have a few when I'm out walking. Okay, horror story number 1. So, it's hilarious. So I am probably 4 or 5 years in as a therapist, probably 5 at this point. And I'm doing outpatient physical therapy in a clinic. This is back in New York State when I lived up there. And I'm seeing a patient, and I'm seeing, and this is relative, I'm seeing him for back problems. You know, this person worked out in the on the roads, or road construction crew, so they were on a workman's comp, and they basically had said, okay, we're going to go ahead and I had a workman's comp case, so the guy was off. So he didn't, he was, come to therapy. I was having him come 3-4 times a week, and we got his leg symptoms to calm down. He had them in both legs, and he actually had pain in his testicle too. So he was not only having sciatica pain, he was also having referral pain at the same time into his nether regions, his testicles. So this guy was a hurting fool. So first sign of recovery with this is to get the symptoms out of the groin area and try and start to get them at the lower back. And I talked to this guy till I was blue in the face, and he could not get it through his head that when you're I'm sure someone's gonna run me over now. That when you recover, like I said today, you want the symptoms to go from your legs, out of your legs, and into your lower back, what we call centralization. That's literally what you want to do. That's what you should see improvement. This guy, he's like saying, I don't have any back symptoms, it's just my leg. And I said, I gotta get through this guy. It's like talking to a robot or something. Like, look at it. You're not getting better. Oh, my back doesn't hurt anymore. It's only in my legs. And I'm like, I'm telling you, your symptoms are not getting better. You're actually getting worse. If your leg symptoms get worse or stay the same and your back symptoms go away, that's bad. So I was trying to tell him that, and so we tried some lumbar traction. It would help a little bit. He'd go right back, and I'm like, This isn't making any sense. This guy's not working. He's off on workman's comp, and he shouldn't be aggravating it. I can't figure it out. What the heck's aggravating his back? Well, come to find out, this guy's doing yard work. He's like, well, I got some yard work. I'm mowing my lawn. I'm like you're supposed to be on workman's comp. You're not supposed to be doing any yard work. Oh yeah, he's lugging and pulling and doing all this kind of stuff. I'm like, I wonder why you got yourself a nice tan. So he's out there and it's ridiculous how much money he's making. He's making money on workman's comp. Plus he's making money. Hi. Plus he's making money on the side. So guess what I had to do? I had to document all this stuff, saying, hey, look it, you can't be working on the side and you're on workman's comp. Oh, you can't tell him. You can't tell him. You can't tell him that. I said, look it, I have to justify what's going on here, why you're not getting any better, why you're staying the same, or in this case, you're getting worse, and you're not listening to me. So yeah, he wasn't happy with me. He started shouting and screaming, hooting and hollering and swearing in the clinic. I mean, he's a grown adult making an absolute ass of himself. So that was the end of that horror story. He never came back. Never found out what happened. I ended up having to do a discharge, and called the physician up and said, "Hey, guy never came back. This is send my notes to the doctor," and that was it. Never heard anything after that. So sometimes it's unfortunate, but that's what happens. That's horror story number one. Guy sitting there yelling at me, screaming at me. Here I'm in the clinic, swearing at me, like just a crazy nutball. So you just never know with people. All right. Hi. Good. Face looks great. You're welcome. Guy's building a house back there. So horror story number two. So this wasn't too long ago. 6 years ago. Yeah, no, longer than that. 7. I moved down here to Maryland, somewhere in Maryland, North Carolina, and so I'm working at a nursing home, senior nursing facility. So I get down here, seeing the patients in the nursing facility. Beautiful facility, brand new, state of the art. All of our equipment is out in one of those pods. I kid you not, our wheelchairs, our rolling walkers, our Hoyer lifts, rollators, you name it, mat tables. It's all outside. You have to go outside the building and it's stored in a pod. And I'm like, what are you people doing? And they're cleaning this stuff outside, which is fine, but they're leaving it outside in the rain. They get all rusty and all this other. Oh boy, that was a horror story. He was a dumbass. Yeah, he was. Yeah, that last guy was. Yeah, he made himself look foolish too. And so here I am, and they're looking at me like I'm damaging the equipment. I'm like, I didn't damage this equipment. This is what you guys have stored. You have this probably $20,000 worth of equipment in this pod, dumped on top of one another. Nothing's organized. Half of the stuff is getting broke because they're just throwing stuff on top of it. And then when you get it out, you have to rifle through everything to find what you need. Hopefully it's not bent or broken. Get it out of the pod, and then get it out of the weather, clean it again, and then get it. I mean, it's absolutely insane. Hey, how you doing? It was absolutely insane. That horse. I mean, it's like, really? Can you imagine if you're the patient and you're like, why the heck is this walker bent? Or why why is the wheel not rolling right? You want me in this chair and the wheel's not even rolling right? I mean, it was just, I mean, talk about being embarrassed. I mean, because here I am representing the company and the equipment that they're giving me. And obviously I have to spin it so it sounds good because, you know, but you know, you kind of, it puts you really in between a rock and a hard place when it comes to that kind of stuff. So you just never know. It's like you're just you, some of the experiences that you get. So that's my horror story, the equipment horror story. And then the company's like, oh yeah, you know, they made it sound like it was normal. Like, this is not normal. You don't have your equipment outside in another pod. You have equipment. You have your equipment inside, so that you know have a closet or a room designated specifically for the equipment, to where it's organized, it's tagged. You have it to where a piece of equipment needs to be clean. This is the dirty side. This is the clean side where clean is tagged, or if something's broken, you have a tag on it to where, hey, this needs to be fixed. None of that. It was, I mean, this is people running the company, and me having to explain something you would think is as simple and as basic as that. You know, it's a wonder why these companies just don't go downhill even faster. They have morons running these companies. You know, I don't know whose ass they kissed or who the heck they had to sleep with. But sometimes you wonder with these people. It really is cutthroat the more you move up management. So that was my horror story with that one. And as you can see, I still get fired up about it. And that's when I first moved down here. I didn't stay there very long. Let's just say that. And it wasn't because of the people. The people were nice and the patients were great. But it was just, I mean, the way the setup was and how, and the management structure of it was so piss poor. You know, I don't have, they had their regional manager. Now, I don't have nothing against physical therapist assistants. At one point, I was an assistant before I went back and got my doctorate degree. But to have an assistant having a regional manager telling the physical therapist, oh yeah, you should do this and you should do that. And I'm like, wait, this makes absolutely no sense. You can't have a physical therapist assistant, even though you're regional manager, telling the physical therapist what to do. That is a huge, huge no-no. Never should be doing that. Hey! So that, I mean, I don't have a problem with it, but when the PTA starts telling the PT what to do, that's when there's an issue, because literally the American Physical Therapy Association has lines of sentences all about the PTA, what their role is versus what the PT's role is. And the PT and all the sentences of all the American Physical Therapy Association always designate that the PT oversees the PTA. They do not have autonomy, but boy, so I didn't stay there very long. Didn't have a big, you know, it is what it was. I think I was there like, it was the shortest place I ever worked. I think I worked there like 3 months. That's the only place I ever worked at that. I mean, I was a shorter cook for years. I worked longer in some of these places than 3 months, but that place was just, it was ridiculous. And of course, you know, I always look every once in a while, and I see that they've changed management structures more than some people, you know, change dirty diapers every day. They change management so much. So my nose definitely was correct, smelling a bunch of hoo-ha that was going on there, and I got out while it was good. So that was my horror story number 2. Official, hey, PT knows me as, yeah, 1SB, I remember you. Long time no see, or no see long time, depending on where you're thinking about. So that was my horror story number 2. Horror story number 3. Now, this is a physician. Let me tell you, some of the, you know, I understand you go to school a long time, but oh man, to think you're never wrong, woo, blatantly wrong, blatantly inconsiderate, oh man. And the only reason why they're ignoring it is because you bring a lot of money into the hospital. Man, some of these orthopedic doctors, they need to have their necks checked. They need to literally get checked out, which is ridiculous. I just want to choke the living shit out of some of them. Tiny little people. You know what I'm saying? Like 5'8", 5'6", and I'm like, oh, okay. all right, you know, if I didn't like my profession and I didn't like my license and my livelihood, I'd probably try to put you to sleeper hold, choke the living shit out of you for a few minutes. Some of these doctors, I tell you, they just need a good beat down. They never got a beat down. You get a beat down once, and then you know. I've been beat down before. I know. You know, once you've gotten that, you know, you can give it back. So, anyways, hey, Rich, careful with the PTA talk. Anyways, this was probably 5 years ago now. So we had a transition, and you know, with a transition of powers, things happen. You know, you got to go back out and play Mr. and Mrs. Nice Nice to all your referring physicians. Well, I had one referring physician. I'd like to say his name, but I can't. All I can say he's an a-hole. Go there. I present everything as nice as I possibly could. Got there extra early, and literally, this pompous for about 15 straight minutes just went right at me. Went right at me and went everything. And it was like, okay. And the problem was, is I was in his office in the morning, and I was trying to present, uh, you know, the hospital in a nice light, and and you do the best you can. But boy, you know, when you're between a rock and a hard place, and you know, I spun it as best as I could. But needless to say, I mean, it was literally 15, 20 minutes of, you know, me sweating, hearing, you know, this and that about the hospital. And I mean, literally, it ended up being a complaint section. And literally, I'm here to present, you know, what services I can offer you. So, you know, that person ever, needless to say, not good friends with stuff like that. You know, and the hospital's funny like that. You know, as long as, you know, as long as they're making money, as long as they're bringing money in, they just turn their head and close their eyes. It's unfortunate sometimes, but you know, there's a lot of that happens. Uh, heck, that was a long time ago now, but yeah, it still fires me up every once in a while. But what you gonna do? You know, then they get you on defamation of character or some nonsense like that. I mean, they all kinds of uh, hoopla and blah 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 lawyer talk. You know, I think Back to the Future when they talk about getting rid of lawyers. Sometimes I wonder if that would be the best thing. Too many lawyers, ridiculous. Too many sue happy people. Welcome, Richard. Yeah. I know Rich. Rich, I've known for a long time, and but anyways, that's a story for another time. But hopefully you guys are all doing well. I think I definitely told enough horror stories for today. Got plenty more of those. You do this long, I'm sure everybody's got their own horror stories, and hopefully, hopefully today, you know, the video helped you guys all out, have you understand a little bit more. You know, I think truly understanding medically what's going on with you really does calm your anxiety and worry and stuff like that when you understand why you're having certain symptoms and what you can truly do in your own home and what things you can do to help you to hopefully recover faster versus people just like talking over you to really I'm you know really explain, okay, this is what's going on in layman terms as much as I possibly can. Hopefully that really can help people, and you know, that's really what I'm out here doing. You know, I'm not out here doing car videos and, you know, having, you know, 2 million subscribers because someone seen me put together a Ferrari. Those seem to do quite well, those videos. But anyways, all right. Again, thank you all for coming. Thank you, Brown Eye Trucker. Hopefully you're doing okay, and I hope you continue to recover. And you guys can always DM me down below. Uh, I think I think I'm gonna do one more video, probably maybe a couple more videos. I want to do one on I hadn't done in a while on SI joint and snapping hip syndrome and stuff like that, which sometimes you can get confused with back problems. So I think I think I'll have a video on that coming up, and I think I'll have a video on truly, the symptoms difference between just I pulled my back muscle. I already talked really the symptoms difference between herniation and a facet arthritis, but I think I need to talk a little bit more of what happens if you just pull your back muscles and what that should feel like and how that represents, or excuse me, not represents, but presents versus the other two. All right, y'all, y'all have yourself a good afternoon. And like I always say, look up and keep smiling. See you next time, folks.